Welcome to Horizons of Thought. For those of you new to this channel, my name is Donald Eric, and normally on this channel, I talk about how to address difficult topics from multiple points of view. Today, I'm simply going to present to you an increasingly common view of our future handling of the COVID pandemic. This includes doctors and researchers who study various aspects of the spread of pandemics. In particular, much of the content of this video was originally written by a Singaporean doctor. At the time of constructing this video, she wished to remain anonymous, so mine is the face you will see and the voice you will hear. By March 3rd, 2020, you had all seen the flattened curve meme so often that news stories were being written about it. When I saw that meme, I knew what it meant. It meant that COVID was an endemic human disease, and eventually we would need to plan and support policies that treated COVID like an endemic disease. Flatten the curve means COVID is here to stay. For the month of March 2020, I was hoping the idea behind the meme could possibly be wrong. I even posted a link to the now famous article called The Hammer and the Dance on March 23rd, 2020. This article's suggestions for stomping out COVID-19 worked in New Zealand for about 18 months, the longest of any place on Earth, outlasting even Taiwan and Vietnam. But I knew COVID wouldn't go that way everywhere because most places on Earth don't have the wealth or the policymakers with the leadership skills to follow the advice of that article. And if COVID didn't go away everywhere, it would not go that way anywhere. So I knew what flatten the curve meant. It meant eventually nearly everyone on Earth will get COVID. It meant COVID-19 will mutate into COVID-20, COVID-21, COVID-22. Forever. That's what it means for COVID to be an endemic disease. Let that sink in. Right now, vaccination is the only real weapon we have against COVID. Not because it prevents infection. It does not. Not because it prevents COVID mutation. It does not. Not because there are no treatments after the fact. There are. But because the major vaccines, Pfizer-BioNTech, Moderna, Johnson & Johnson's Janssen, and AstraZeneca all drastically reduce the rate of severe illness, ICU admissions, and death. Yes, I know some of my viewers don't believe that any COVID vaccines can help, but at this point, there is so much worldwide evidence for this claim that I consider the evidence unassailable. Scan any database of ICU admissions and vaccination rates, and you'll see the vaccine affords protection for multiple months, reducing risk of hospitalization to as low as 1 in 26 that of unvaccinated people. While the effects don't last forever, like many vaccines, it can be augmented with regular booster shots once every 6 months to a year. Yet despite my support for vaccines, I offer one caveat. None of the vaccines has been approved for administration to children 17 and under yet. This is because children get this disease far less often than adults and far less severely. For instance, Singapore has seen a surge in pediatric admissions for COVID, but very few adverse outcomes such as ICU admission or death. In the US, about 500 children have died around the time 700,000 adults died. So I leave my notes from the Singaporean doctor and offer my opinion. Until we know whether any of these vaccines offers at least 100 times the benefit compared to the small but real risk of adverse effects such as allergic reaction or heart damage, I do not expect approval for the use on children, and I would be upset if such approval came before such evidence arrived. Put simply, I do not support unethical experimentation on children. And we don't need their participation anyway for what I'm about to say next. So vaccination in Singapore and elsewhere began with the elderly and the vulnerable. Singapore worked with the public and elderly to discuss vaccine hesitation, offering public mass education, members of parliament personally visiting elderly people, and even some incentives to vaccinate, like easing early restrictions based on vaccination rate. These measures helped increase vaccination rate. In the meantime, the only other tools to slow the spread of COVID involved restrictions. Testing for COVID can be quite invasive. My first experience with a nasal swab test was quite a violence to my mind. Nasal violation is quite horrifying to me. Contact tracing is also quite intimidating. Many of us do not want governments knowing where we are at all times. Masks are not fun. I find they make my eyes itch, my nose clog up, my throat gets sore, and worst of all, they fog my glasses to the point of near blindness. Lockdowns and restrictions are also quite onerous. Singapore applied and released restrictions to prevent a surge in hospital cases whenever numbers threatened to overwhelm. Many of these measures were frustrating. I was there on a trip for some of them. But at the time, there was good reason to believe that these measures kept hospitals from getting overwhelmed. These procedures really helped track and contain COVID cases. In Singapore, these measures helped lead to COVID having a mean case fatality rate of 0.04%, with a maximum of 0.09% now that much older people are encountering the disease. So this brings us to the current situation. Currently, 80 to 85% of Singaporeans are vaccinated. This level of vaccination was achieved under the encouragement that once Singapore reached 70% vaccination, the country would transition to learning to live with the virus as an endemic disease. But what would actually doing that look like? We can use the flu as an example. It is a dangerous endemic disease that kills heaps of people every year, and so will serve well. Do we routinely conduct tests of asymptomatic people checking for the flu among school workers, food and beverage workers, or hospital staff? No. Do we regularly quarantine not just people with the flu, but anyone who has had contact with them? No. Do we make healthcare workers wear N95 masks to prevent the spread of flu? No. Do we quarantine healthcare workers who come in contact with people who have the flu? No. Apparently, last year, Singapore did not even do that last form of quarantine with COVID, and the price for doing this now is a staff shortage. It is hard to have enough people to work when you keep sending them home. Yet in Singapore, even after vaccination rates surpass 70%, the answer to all these questions remains yes. And alas, there remains one very good reason to do so under the current situation. This reason is that we have done nothing anywhere in the world to prepare people for what it means to live with endemic COVID. And Singapore could choose to lead the way. They can do this by combating fear-mongering in the media and in public conversation. First, they must do the math. Find out the antibody rates, vaccinated or previously infected people, needed to make sure the medical system is not likely to be overburdened with endemic COVID, and stick to that number. Singapore has reached a high enough number, but that number will differ based on the nation and quality of healthcare reserves. Other nations in weaker positions must recruit new medical people or adopt new medical protocols if the required vaccination rate is unrealistically high for their current situation. Secondly, they must educate people on the real risks of COVID infection. When I ask people what the risk of hospitalization is for people who get COVID, I get numbers from 15 to 50% out of people. Those numbers are 1 to 2 orders of magnitude too high. Right now in Singapore, about 2% of people who test positive for COVID ever need oxygen, and far fewer need ICU treatment. This information is similar in other countries with high vaccination or previous infection levels, and is freely available from every major medical or disease association. Similarly, countries with more experience of COVID will tell you that if you have ordinary mild COVID symptoms, stay home, drink, and rest like you would with the flu. If you have more severe symptoms, by all means, phone your doctor, but still stay home unless your doctors call you in. So you don't need the hospital unless your body isn't getting oxygen through the blood. In Singapore, everyone has a blood oxygen monitor. Numbers below 90% for extended time are definitely hospital worthy. But by then, the trouble breathing, slight blue skin, extreme pain or pressure in the chest, and or absurd levels of drowsiness that come with real risks should send anyone to the hospital no matter the cause. And while I am not a doctor and cannot give medical advice, there are doctors who can. And the Singapore government's PR department ought to be able to whip up a nice, pretty, and effective campaign saying pretty much the same thing. Because keeping people who should be staying home from flooding the hospital system is the major battle in combating an endemic disease amongst otherwise vaccinated populations. The next step is easy. Stop mass screening. Yes, the same measure that saves lives before a disease is truly endemic starts to hurt or kill people once the disease is everywhere. This is because mass screening is a tool for eliminating COVID, and for countries like Singapore that decided to end zero COVID policies, they are no longer necessary or helpful. If you test so often that you uncover every asymptomatic or mild symptomatic case of COVID, you also exhaust the testers who don't know how to then give good advice to people who test positive for COVID. People with no symptoms or mild symptoms should just go home and chill like they would with the flu. If the house is full, everyone can chill together until they get COVID and then recover. Instead, now hospitals and medical services get flooded with people, and that is just exhausting for everyone involved. When the hospital staff get exhausted, the government needs to apply restrictions again for no other reason than to give the staff a rest. Next, tolerate the unvaccinated. I say this in part because your goal isn't really vaccination. It is a percentage of the population with significant COVID antibodies. Secondly, most unvaccinated people just haven't gotten around to it. If you are in a rural area or isolated or poor, it can be hard to find the time to get vaccinated. And having people come to you or your community center can and will help. Such measures should be taken as they help the poor and disenfranchised stay safe. But for the rest, there will always be people who choose not to be vaccinated. They have higher risks of COVID complications. And while we can and should encourage them to vaccinate, applying force like vaccine passports doesn't help at all. People who won't put foreign substances, vaccines, into their bloodstream are, and have always been, part of human existence since the invention of the first smallpox vaccine. Yet as long as there is space available, treat them in hospitals and ICUs. And if, after reasonable and due care, they die, that outcome was the result of their own choices. They took the risks, and people have the right to live and die with their risks. So next, stop the incessant bad press. In countries with freedom of the press, you need to live with private sector media. If it bleeds, it leads nonsense. But no government needs to perpetuate bad press themselves. They don't have to advertise the number of dead in the press. Just put it in the usual medical statistics. They don't have to do anything to promote a sense of fear. Once a population has been vaccinated at the level appropriate to the medical situation in the country, COVID deserves as much press as the flu. A little during peak seasons, but not much. So lastly, just live. These simple measures lead to a world with COVID everywhere. Some people who get it will need to go to the hospital and get intensive care. But right now, Singapore only fills up 2% of their ICU beds. They have the beds and the medical staff to run the beds for almost 2 orders of magnitude worse situations. That is plenty to handle any increases in serious COVID, which will probably come once or twice every year during COVID season, just like those serious increases did every year for flu season since time immemorial. In the years before 2020, Singapore had 600 influenza deaths per year. It had only 80 COVID deaths over 2 years. Once a country reaches a decent level of population antibodies, vaccinated or previously infected people, it is time to simply live. Take off the masks unless you are sick. Stop the social isolation. Send children to school in person. Enter and exit buildings freely. Walk, drive, cycle, do martial arts, eat out, go to raves, go to church. Risk death. It comes for us all anyway. In the meantime, live. This is Donald Derrick signing off from Horizons of Thought.